Welcome to Learn Medical Spanish. Today I'm going to go over major joints in the body. So this is some anatomy, and it overlaps a bit with previous videos because, of course, I've done like upper extremity and things like that. So we've already done some of this, but repetition is good anyway, right? Because you need to hear it multiple times to learn sometimes. So let's go over these joints. So quick reminder, I've got 5 really focused beginner lessons in medical Spanish, kind of the 5 first lessons you'd want to get, especially if you're a provider. Go to learnmedicalspanish.org/lessons to get those. So if you haven't already done that, highly recommended. So learnmedicalspanish.org/lessons, and I'll put a link in the episode description. All right, so we're going to go over these joints. I'll say them in English, then I'll say them in Spanish a couple of times. So the first word is joint. There's a couple ways to say this, but I'm going to give you 2 options. So how do you say joint? La articulación. La articulación. Which of course sounds like articulation. So there's lots of words like that where there'll be a cognate of a synonym. Cognate meaning it sounds the same in both languages, and then of a synonym oftentimes. All right, what's another word for joint? La coyuntura. La coyuntura. So throughout the rest of this lesson, we'll mainly use articulación as opposed to coyuntura, but both are acceptable ways to say joint. So how would you say jaw joint? Jaw joint. La articulación de la mandíbula. La articulación de la mandíbula. So there's another anatomy term for you, because of course that's the word for mandible. Next phrase, vertebral column. La columna vertebral. La columna vertebral. Neck. The neck's not a joint exactly, but, has a lot of joints in it. So what's the word for neck? El cuello. El cuello. Cervical spine. La columna cervical. La columna cervical. So some of these phrases will be borderline medical jargon, right? Like if you say to an English speaker, your cervical spine, what percentage of people understand that? I don't know, maybe 50%. So same thing in Spanish, like you don't know exactly who's going to understand what. So you kind of, look at their facial expressions or whatever and use synonyms if you need to. But you can kind of figure that out as you go along, just like you would in English. But it's useful to know at least a little bit of the slightly more technical words sometimes. How about low back? La espalda baja. La espalda baja. Or another way to say low back would be la cintura. La cintura. Cintura actually means waist, but because your low back is where your waist is, people will sometimes use that word and kind of point to their low back. Next, lumbar spine. La columna lumbar. La columna lumbar. I feel a sneeze coming. So another way to say lumbar spine besides columna lumbar, we could say like a lumbar zone. So how would you say the lumbar zone? La zona lumbar. La zona lumbar. So just like cervical spine, is it jargon or is it layman's terminology? It's kind of in between, right? Because a lot of people know the word lumbar in English, and I'm sure a decent number know it in Spanish, but not everybody. Shoulder. So totally different joint. Shoulder. El hombro. El hombro. So why are we saying the? Why are we saying el, la? Because in Spanish, you almost always use the word the when you're talking about body parts. So that's why you really want to learn, is it el, is it la, is it whatever? Next is shoulder blade. La escápula. La escápula. So that's the cognate for scapula, but there's another one that I understand is somewhat common as well, and that is el omóplato. El omóplato. That's another word for shoulder blade. So a lot of this stuff will be regional once you start getting into these little variations. So it depends on what country you're in or whatever. But I suspect both of these are understood pretty widely. Collarbone joint. What about the collarbone joint? So that's kind of a general layman's type term, right? But how would you say collarbone joint? La articulación de la clavícula. La articulación de la clavícula. So again, borderline jargon with clavicle, but like a lot of things, point at it when you say it, like this joint right here, but you can kind of say the phrase too so that they kind of hear it and see it at the same time. Next, elbow. El codo. El codo. Wrist. La muñeca. La muñeca. Finger joints. Las articulaciones de los dedos. Las articulaciones de los dedos. And technically, that phrase could mean finger joints or toe joints, because dedos are both fingers and toes, like digits. So if you really wanted to specify, you could add something like de la mano, of the hand. But that's a really long phrase at that point. But you could just point at it, or they obviously might know from the context. What about the hip joint? La cadera. La cadera. Pelvic joint. So we're not saying all the technical terms for all the different pelvic joints necessarily, because there's too many and they're very much medical jargon. But how would you just kind of say pelvic joint? La articulación de la pelvis. La articulación de la pelvis. So la pelvis, the pelvis. So you can use that to refer to various things. Knee, how would you say knee joint? Or just the word knee? La rodilla. La rodilla. Ankle. El tobillo. El tobillo. Toe joints. So I think this is going to be about the same as the other phrase, maybe exactly the same, when we said finger joints. Las articulaciones de los dedos del pie. Las articulaciones de los dedos del pie. Sounds like a lot, but that's how you say toes, dedos del pie. So, in English it's one word, in Spanish it's 3 words. So then you just add the joints of the toes. All right, so I mentioned it at the beginning, but if you haven't already, check out those 5 very focused beginner Spanish lessons, beginner medical Spanish lessons specifically, at learnmedicalspanish.org/lessons, or look for the link on your app. And if you're on YouTube, check out this playlist here with some more medical Spanish dialogues and this video that explains my medical Spanish CME course for emergency medicine providers. And if you're on the podcast, just scroll up, scroll down, see what the other topics are, and see what you want to learn today. Thanks for being here. I'll see you next time on Learn Medical Spanish.